It's of somewhat somber circumstance that we're called together at this moment. Suffice it to say that the health and safety of every single citizen of our state is of paramount importance to us all. And that has been on full display over the last few weeks. So it saddens me to announce that as of earlier this morning, we as a state have lost our first Hoosier to the coronavirus, COVID-19. Janet and I, and on behalf of the entire state of Indiana, want to extend our deepest sympathies and condolences to the family and to their loved ones of the patient who passed away earlier today. While we had hoped, prayed, and worked hard so this painful day would never occur, sadly, we knew it would. Still, sadly, we anticipate that it will again. This just underscores how incredibly important it is and timely that social distancing is the best way at this moment to slow the spread of COVID-19. I want to specifically thank the physicians and the staff at Community Health Network who did everything in their power to care for this patient. And so with that, I'll turn it over to Dr. Ram Yaleti, the Chief Physician Executive at Community, for some additional case details. And then I'd ask Dr. Box to provide an update on testing and community spread. And then I'll ask Dr. Kane to do the same before I return. Dr. Yaleti.
Thank you, Governor. It is not what I want to be talking about today, but want to explain how real this is for all of us. This individual fits into the high-risk categories of being over age 60 and having health issues. The problem is that this individual would not have died if it was not for the COVID-19 infection. What makes this really hard is that this individual's significant other was also infected, and so the two of them could not be together when this patient passed. We had to do iPad conferencing so the two individuals could see each other. So that this individual would not die alone, one of our nurses stayed in the room with this patient. So the one message that we need to take home for all of you is this is the beginning and this is real. People, if you're above age 60, if you have diabetes, cancer, heart condition, lung condition, or hypertension, I urge you to self-quarantine yourself for the next several days to several weeks. Individuals that are young, college kids, all of you are saying, well, it's not going to affect me. You're not going to get sick, but you will get somebody else sick. If you go visit your parents or your grandparents or other healthcare workers, they will get sick and they will die. Sadly, again, this is not the first patient and this will not be the last. Also, with this, we've had several of our own healthcare workers who have to be quarantined. This is paramount right now. We will not have enough healthcare workers to take care of all the patients that are going to get sick. So I caution all of you to be careful, and if you could remain cautious and not interact with others, because we cannot afford to have healthcare workers quarantined or sidelined. We don't have enough healthcare workers as this worsens. Additionally, we don't have enough beds. There's too many people getting sick. So over the weekend, we've stopped all elective surgeries and cases in all our hospitals. We're trying to open up our surgery centers, operating rooms, and other facilities so we could handle more patients. We're going to be using the ventilators or breathing machines that we'd normally use in the ORs to take care of these patients. And so we're doing everything we can, but I'm still concerned that in the next couple of weeks, all the hospitals in the state won't have enough beds or enough ICU capabilities. So we're doing everything we can, but the best way you could help us is to self-quarantine yourself, minimize the social distancing is not just a fad, it's real. That is the one way we could help prevent further spread of this disease. That's the only way we could prevent it. We have no treatment, we have no vaccine. So it's paramount that we do everything we can to minimize interaction with others and keep that social distancing apart. That's the only way we could try to prevent this from happening worse. And honestly, it's going to happen to more loved ones, and so let's do what we can. Thank you.
First of all, I want to echo Governor Holcomb and Dr. Yoletti's sadness at the loss of our first Hoosier from COVID-19. The news today confirms the shift that we have been seeing in cases of COVID-19 across the state of Indiana. Here in Marion County, it is clear that we're seeing community spread of the novel coronavirus. The cases that we have seen recently cannot be traced back to someone who traveled to Italy or to China, or a particular conference that someone attended, or being in close contact with a positive case. We expect to see more of this across the state of Indiana in the coming days and weeks. This is why it is absolutely imperative that Hoosiers follow the governor's guidance. Stay home, please. Avoid gatherings of over 50 people, but mostly stay home. I know that this makes significant inconveniences in Hoosiers' lives, and we're not used to that. But this is what you can do to protect this vulnerable population that will end up in Dr. Yoletti's ICUs or other ICUs across the state, so that we can protect other Hoosier families from experiencing the same type of loss. We understand that access to testing is a big concern for Hoosiers, and I want you to know there is no greater concern or greater priority for the Indiana State Department of Health than that. We are working diligently to address these concerns. ISDH did receive more kits at the end of last week, and we are expecting more this week. LabCorp is up and testing in the state of Indiana, and they are sending their results to us. I want to emphasize, though, that most people have mild symptoms, and they should stay home, and they should contain their illness in their homes and isolate themselves from other people in their homes so they don't spread it within their families. But unless you become ill enough to go to the hospital, not everyone needs to be tested. We prioritize our highest risk individuals that live in long-term care facilities, individuals that work in long-term care facilities, healthcare providers, not because we think they're of more importance, but because if we test them and they have influenza, they can go back to work 48 hours after their illness is done. But if they have COVID-19, they need to stay home for 2 weeks. And lastly, I want to recognize the amazing compassion and expertise that the healthcare providers not only engaged with this patient's care, but with other patients' care across the state are producing every day. There are heroes, and they need our support. Thank you.
My thanks to Governor Holcomb for the invitation to help update the community today. And I will echo what both the governor and our health commissioner, that I'm incredibly saddened by this loss of life. And my heart goes out to anyone who have lost someone today. The Marion County Public Health Department and Mayor Hotsett have been working tirelessly to take the drastic steps needed to protect the citizens of Marion County. Today, the mayor and I announced restrictions for the community in line with the governor's recommendations that aim to create social distance and mitigate the spread of COVID-19. I cannot stress enough how important it is for residents to practice social distancing. Stay home as much as possible, and please wash those hands frequently. Now is not the time to hoard resources or panic. Now is the time for our community to learn how to work together to curb the spread of the virus. We're all in this together, and only together can we minimize the impact of this crisis in our community. Take care of our vulnerable neighbor. Reach out to your elderly neighbor and ensure those around you know how to access resources that they may need, such as hunger relief. So I applaud the governor and Mayor Hotset's bold actions and all that the state and the city of Indianapolis is doing to provide support to our residents and be able to keep them healthy during these difficult times.
Thank you, Dr. Kane. Let me just add a few comments, and then I'll ask Superintendent Dr. Jennifer McCormick to share a few thoughts, and then Director Steve Cox at Homeland Security to share a few thoughts as well. Earlier today, you should have been in receipt of some additional guidelines that we put out, recommendations. We raised the EOC level to 1. Dr. Cox is with his team and that task force manning our Emergency Operations Center 24/7. We have lowered the threshold or the number of gatherings to 50 from the previous 250. This is aligned with the guidance from the CDC. We're continuing to work with the Department of Education and our schools. We have 273 schools who have already are on spring break or gone to e-learning, but we've got 16 more, and Dr. McCormick, you might speak to that if you would, in terms of being closed down at the moment. We've directed all bars, restaurants, nightclubs throughout the state of Indiana to close their in-establishment dining option, going to a take-home or to-go approach. We have, as you heard Dr. Yaletti mention, we have recommended all hospitals and surgical centers to put off all non-elective procedures at the moment in preparation for any surge that may come, and we anticipate that it will. We have directed all state employees who can work from home to do so, and those accommodations are being worked out agency by agency, department by department. We have closed the Indiana State Museum, the White River State Park. We have postponed our Global Economic Summit that was scheduled to be held later in April. And we will continue on an hourly and daily basis, look for updates on how to respond. I do want to underscore or echo what has been said already by Dr. Box and others about how appreciative we all have been to have received offers of help from the philanthropic community, from the business sector, from local governments, mayors throughout the state of Indiana, on a constant basis, citizens asking, what can we do to help? This is going to go a long way as we all come together. But just know that we are here at the state and city by city, town by town, everything that we're doing now 24/7 is centered around education, communication, and supplies, and making sure that we're getting the word out to citizens wherever they may find themselves throughout the state of Indiana. To those who think that we may be overreacting, I can assure you that we are not. Indiana is under a public health emergency. We are, make no mistake about it, at war with COVID-19, and we will win this war, which requires us on a daily, if not hourly basis, to be nimble enough, agile enough to update our battle plan. And when I say us, I mean all of us, each doing their part. As Dr. Yaletti, as Dr. Box, as Dr. Kane all mentioned, that has to do with social distancing. It's maybe the single best thing that you could do wherever you find yourself throughout the state of Indiana. That means increasing your own personal hygiene standards. That means checking in on neighbors, not knocking on their door, not going in their house, but checking in on your neighbors. This is the Hoosier way after all. It should come as a second nature. But make no mistake about it, collectively, the actions that we are taking today are going to have an impact. We think a positive impact, not adverse impact, on what happens 30, 60, 90 days from now. So just know that this team that's been assembled here today, including that goes far beyond that, mayors throughout the state, county commissioners throughout the state, all those healthcare professionals, whether EMS or the physician, the attending physician, we are all committed and fiercely resolved to seeing our way through these unprecedented times. With that, before we open it up for questions, I would ask if Superintendent Jennifer McCormick, if you could share some words, and then followed by Director Steve Cox.
So good afternoon. I first of all would like to thank everyone who is up here. It has truly been a group effort and a collaborative type of spirit, the way this has been approached, and we do appreciate that. I also would like to thank the superintendents across the state of Indiana, our school health care providers, also our technology directors, our support staff, our teachers, their parents, and our students. It is a very, very difficult time. We understand this is about the well-being of students. The safety and security of our students has always got to be our priority, and I will assure you it is. I will also tell you, we know, we are well aware schools are heavy academics. But right now, we also are well aware we are more than that. We are about the whole child, and that means meals. It means support services. There are a lot of things, daycare, a lot of issues that are playing into this that your superintendents and your school administrators are trying to consider and find solutions. Be assured we are not doing this alone. There are a lot of partners, many of them here, but also across communities who are trying to find solutions. Right now we have 273 districts, as Governor Holcomb mentioned, that are closed. We have another 16, and of those 16, many of them had signaled they're on spring break, and they will be making announcements eventually. We also are in communication with the charter schools. Right now we have about 95% of our charters that have announced closures. Our non-pubs, we've also been in contact with our private schools. Right now we have about 70% that we know of that have also closed. And when I say closed, that means close their doors, no instruction, or they're running e-learning day, or a combination of closure and e-learning days is really vastly what's happening across the state. Many of our districts are trying to provide meal services. What does that look like? We've received a waiver. We've been working diligently to get this waiver. That means that our districts, no matter what that threshold for free and reduced students, we found a mechanism to provide food for everyone during this time and trying to figure out the best way to distribute that food. We are still not perfect by all means, but please be assured that we're trying to find solutions. Daycare. We are receiving an enormous amount of questions. We know it is a hardship for families. We are well aware of that. We do not close down school or provide e-learning without being cognizant of the economic and the hardship that that provides to families. So again, it is difficult, given the situation, to find solutions, but your schools are trying to address that. So again, thank you to Governor Holcomb and everyone here, but to our superintendents who are working tirelessly out in the field, thank you. I am indebted to you.
Good afternoon. I'd like to offer my condolences as well to the family and friends of the patient that lost his life today. I'm here to speak to the Level 1 activation of the State Emergency Operations Center. Level 1 activation denotes the highest level of activation for the State Emergency Operations Center, denoting full emergency conditions exist within the state. In this instance, the governor is directly involved in the response, operations, and planning that take place in the EOC in response to the COVID-19 emergency. And relative to the COVID-19 emergency, the Indiana EOC is fully operational with some select emergency support functions that are available virtually and can be activated immediately to respond in person to the EOC if necessary. I'd also like to thank all emergency response personnel in the state of Indiana, the first responders that are out there on the front lines doing their job 24 hours a day. They truly are out there on the front lines, and as Dr. Box mentioned about the hospital workers, those first responders, law enforcement, EMS, fire, they also are heroes and are out there and must be acknowledged. So